Hey guys, Dr. Parikh here. This is my lovely patient.
Hi everyone, I'm Linda.
And Linda is having surgery in a couple of weeks. We are very excited. And
I'm excited too.
Thank you. And we feel very privileged that you've chosen our practice. Linda's going to be having an upper eyelid surgery, lower eyelid, scarless lower eyelid lift, in addition to a fat transfer and laser of her whole face, an ultra clear laser, and then we're going to be topping that off with a deep plane facelift and necklift. I wanted to ask you a couple of questions.
Sure.
And I think the first question is, why are you what made you think about doing the surgery?
Yeah. Well, I've been actually thinking about it for a long time. And just recently, right, I'm a little bit over 50 now. And recently when I look in the face, I don't look how I feel, right? I feel like I'm still about 26, wild and crazy, out there having a lot of fun. And I just didn't see that in the mirror anymore. And I wanted to match up how I felt inside with what I see in the mirror.
Thank you. I mean, that is, you are not alone in that feeling, and a lot of patients will choose to have a facial rejuvenation surgery for that reason alone. They just feel like their energy level, their activity level they feel great, and they might be in their 50s or 60s, but then they look in the mirror and they feel like there's a little bit of that mismatch. So
Total
I'm glad
mismatch.
you're doing this for yourself. You mentioned that you wanted to do something nice for yourself.
Yes.
So why did you choose Dr. Lieberman and I as your surgeons? Why'd you come to L&P Aesthetics?
Well, I've talked to a lot of plastic surgeons, and a lot of them don't just focus on the face, right? A lot of them will do some face work, they do tummy tucks, they do other body work. And I was really looking for a practice that specialized on the face, right? That didn't do anything else. That's all you guys do all day long, in and out, and that's all your staff does all day, in and out. And then just, after meeting with you and your team, I felt right.
Well, thank you.
At the end of the day, it just felt right.
Yeah, you're right in the fact that all we do is faces. Doing a facelift today, and we probably do about 2 to 3 a week. So we're very comfortable navigating around
Absolutely.
faces, and especially your face. What are you most excited about, like in terms of getting ready for this? Because it's it's daunting for anybody, and I could tell that you don't love needles and pokes. We just dissolved a little bit of filler. We do see patients quite a bit in this day and age that present and have had filler maybe elsewhere, and Linda had a little bit of filler around her mouth, and I wanted to kind of just have a blank canvas, so we dissolved a little bit of filler today, and I could tell she was a little bit jumpy when it came to needles. But what are you most excited about?
I think I'm most excited about the long-term outcome.
Yeah.
Right? I know nothing's going to be immediate, and I understand the recovery process, but I'm just, looking forward to matching up my inside with my outside appearance, in the long term.
Yeah. And, I think you will see a change the day we take your dressing off. Yes, you will look like you were at the Mike Tyson Jake Paul fight, and that's okay. Everyone looks like a beat up for the first week, especially. I think by the time you get into between 2 weeks and 3 weeks, you'll feel much more presentable, and you'll feel like you can hang out with your sister and your mom, go to dinner, like you mentioned, they're coming to take care of you. And then long term, to us, 2 months, I think you'll be really happy with this outcome. You'll see the immediate change, especially like around your eyes, getting rid of the lower eyelid bags, and your eyes will look more open. So that's great. Here's a question that I think doesn't get answered enough, and it would be nice for you to share that detail. What are you most scared of? You probably have lost a little bit of sleep just thinking about this, and you may lose more, which is totally normal as it gets closer. But what are some of the worries that are going through your mind?
So I'm so tired at night, I don't lose sleep over
She's
anything.
working too hard.
I got teenage boys. But I think I'm a big baby when it comes to pain. So that's my only thing.
Yeah.
Right? What it's going to feel like when I wake up, what's going to be oozing out of my, stitches. Just the pain part is what I'm really nervous about.
So I have good news for you. This surgery, at least the combo of surgeries that we're doing for your facial rejuvenation, are not very painful. The eyelid surgery, some people don't even have to take any medicine to help with discomfort after surgery. The overwhelming feeling most people have after a lower face and neck lift is just tightness, because we've kind of zipped this up to create a really nice sharp neckline and jawline, and it takes some time to get used to that tightness. So I'm hoping that you will be pleasantly surprised in terms of any discomfort that you feel afterwards. So
And I just don't want to scare my caretakers after the surgery.
Oh.
I've been warning them, it's not going to be pretty.
She has her sister and her mom helping take care of her. They're going to stay locally because you are doing you're going to be
Yes.
participating. At least I'm so happy. I think your recovery will be also faster because you're going to be doing a recovery package
Right.
that we encourage all our patients to do, and that's a combination of hyperbaric oxygen, red light therapy to help with inflammation, and then a combination of customized IV or intramuscular injections to help with your recovery. And I think you will see a huge benefit. I've seen, I think it cuts people's healing time down by half, maybe more in some patients. So that's great.
Awesome.
Yeah. Okay.
I'm excited.
Excellent. Yeah. Thank you for trusting us.
Absolutely.